Hi, morning. Something for you. Thank you for coming. Morning, Dog.
Hi, how are you?
I don't know if I can say I'm okay or
You're
not.
okay now. There were no notes. Negative.
Really?
Yeah, so it's really the earliest stage of cancer that you can get.
Really?
So let's take a look at the one. So basically,
It's
there's
official.
nothing. It's official. No need to see any other doctor.
From my breast, not from my heart.
Okay, from your breast. No problem. Any problems with the wound?
None.
None? No fever, no
Took it
pain?
off already. Kasi tagal bago ko nakabalik eh.
No problem. How's the arm movement? Sinalbog the blood. O ba't parang namumula?
Eh kasi yung sanay siya sa local na
Local?
na tape.
The tape! Oh, okay. Yeah, that's why I'm saying dapat wala ng tape.
Sabi yung imported yung tape, nag-replace ko.
Talaga? Pag local yung tape, wala. Interesting.
Eh, local lang yun.
Okay, konting update. So how many days na?
September 16.
Today is the 28th. More than enough. It's good. It's very easy.
Oo.
No. I just needed to turn so I don't have to bend too much over. So what are you doing at home? You're going out? Really? You're staying at home? Why? Hand on your head. Higher. Very good. Alright, you're all set.
Can I put it on?
Yes, you can. It will feel numb for a couple of months. Ano yan, manhid yan dahil nung iwan namin kasama yung mga nerves. And then after maybe 3, 4, 5, 6 months, it will feel different, like any sugat. Parang pag nag-iiba yung panahon, parang may konting kuryente. Ganon lahat ng peklat. Basta may peklat, magre-react yan. So basically, continue the exercises. Might as well do both arms. Healthy lifestyle, active, and proper diet, and then Once a year, you just do your annual mammogram. And then the self-breast exam. You already have the how to do the self-breast exam for the other breast and for the breast that's not there. It's gonna feel for lumps and bumps that, you know, let's say now you feel nothing and then next month there might be a lump, so you have to show it to me. But the chances of that happening in your disease and your condition is so much lower than any other kind of breast cancer. Like I said, it is designated as stage, almost like stage 0. So that is the earliest we can get it, stage 0. We do not give chemotherapy for DCIS.
Okay. So there is no after treatment anymore?
None,
Yay.
unless you want.
I'm not.
Probably next year, around this time, September, 1 year after the surgery, another mammogram, and we'll do blood test, X-ray, just to be complete. So read up on your disease. Actually, it's non-disease. It's the best kind of cancer you can get, basically. It's not even considered a cancer anymore. It's what we call the pre-cancerous lesion.
So it's not invasive?
It's not invasive, definitely. It's non-invasive. So if it's non-invasive, you can't really say it's cancer. Almost all cancers I know, the characteristic of a cancer is invasive. So since it's not invasive, it's hard to say whether it's really a cancer or not. But there definitely is precancerous. If you had left it alone, there is a very, very, very strong chance that it would have developed into an invasive cancer. That's why they are advocating aggressive treatment for patients with signs of ductal carcinoma or, you know, suspicious signs. Some centers are masyadong they can be a little, in fact for a while some of the surgeons here were complaining that the breast clinic was over-reading the mammograms. Kasi lahat na nakikita nila, pinapa-biopsy. Well, you can't blame them. They want to catch it early. And it's hard for us to understand, wala kaming nakakapa, tapos ibaba. It's like really looking for a needle in a pile of needles. And it's the one needle that you have to look for. So it's very hard for us to conceptualize removing something that we cannot see or feel. But we're getting used to the idea in the sense that in your case, since the pathologists were in agreement, I think more than one pathologist read your slide, they were all in agreement that it is DCIS.
And it should be removed.
Yes, DCIS should be removed and should be biopsied, because once you have DCIS, that means the chances you of developing real breast cancer or invasive breast cancer is almost a certainty.
Okay. So I'm how many percent healed?
Well, you're healed in terms of the sugat.
No, in terms of the cancer.
In terms of the cancer, it's not there anymore.
So it's 100%?
100% now. Your problem is kung babalik. That's what we call the recurrence.
So what is my rate of recurrence?
For the left breast, a 0% recurrence rate. Now you still have another breast.
Yeah.
See, that's the problem. You can also develop cancer in the other breast. That's why we still advocate. Now you have to tell your siblings.
Yeah, I did already.
Your sisters, your mother, basically your direct relatives, sisters and mother.
Hindi siya acquired.
There is acquired is not a good term. There is a genetic tendency. It can be familial. But before we do testing for the familial, we have to have a very strong family history. Usually 3 generations. So in your case, your great-grandmother, your grandmother, your great-grandmother, your grandmother, and then your mother. You would be the 4th generation. So we investigate 3 generations before you. And in every generation, there has to be breast cancer for it to be considered familial or genetic. Acquired, yes, in the sense na any woman can get breast cancer. Any woman with breasts. And the risk factors are many. There are minor risk factors and major risk factors. The minor ones are yun, mga smoking, alcoholism, nulliparity, not giving birth, or virginity. That's why I said, talaga, di dapat karamihan ng pasyente namin madre. Kung talagang bitin. What else? Obesity. The major ones are age, sex, being female, being a certain age, and having a family history. Or having had cancer before. So if you have had breast cancer in one breast, you are high risk for the other breast. Okay?
Thank you very much.
Thank you. Basahin. Pwedeng basahin, pwedeng huwag lagyan ng gasa, pwedeng maraming pwedeng.
Okay.